After hearing, the entire morning about, all the exciting things, and some of the challenges, I feel, really optimistic about, some of the potential solutions. And, perhaps, we can, over the next couple of minutes, look at, some of them. The Public Health Network Council in Canada provides a mechanism for federal, provincial, territorial engagement on public health, issues. And you can see, there, the Public Health Network Council, is, linked, to the Council of Chief Medical Officers of Health and reporting to the Conference of FPT Deputy Ministers of Health. Now, they're supported by, a number of, steering committees on, various issues, which in turn, link to, task groups and NGOs, universities, et cetera, et cetera. So the question, for us is that turning that into a solution is, is there an opportunity for using, this existing, a network of networks to actually try to think about, bringing something, from a randomized controlled trial, to, some kind of implementation, no longer the land of pilot projects, but, actually, start evaluating and doing implementation. So just a thought. Now, what about stakeholder engagement? I think that's so important. This morning we talk about domestic partners, domestic stakeholders, but international partners and stakeholders. We don't need to actually reinvent the wheel. So, a couple of examples. In recent history. For Public Health Agency of Canada, we are, right now, integrating the community funding program for HIV and hepatitis C. So, that's, an opportunity to think about, how we can actually, partner with, different stakeholders in this room and outside of this room to actually, make a seamless transfer from, the lab, the hospital, the clinics, on promising, proven practices to try to actually bring it to the real world and, apply, the program science lens. Perhaps that's an opportunity. And we have, existing, working groups, perhaps make use of them. Now, CIHR, together, with, other departments, including our Public Health Agency of Canada, made an investment on the pathways to health equity for Aboriginal peoples, which has a component of, program science and trying to actually go that next step to try to actually see if they could, help together with many other partners to actually, facilitate that implementation part. Now, the scaling up of promising practices. I think that's really the important, part that, I like to actually spend, perhaps with the panel the next little while to actually, start thinking about how to actually, do that. So the traditional way of KTEs, you have different publications, different presentations, web conferences, et cetera, et cetera. But, perhaps, one may actually think about doing things in steps of having a coordination of some kind of collaborative opportunities to actually bring together different partners, different stakeholders, including NGOs, universities, researchers, as well as health departments, and involve the health departments early on, in the planning of all of that. When the time to actually do that is at the time to when applying for a grant. And so how that could, be turned around to actually so that if it works, in a small geographic area, demonstrate that it works. Perhaps then we can try it in 3, 4, 5 different areas. Now, with all of those, have different contexts. I heard that, loud and clear today, different contexts. But perhaps, we can actually facilitate that. So with that, I'm going to actually stop, and I look forward to our discussion. Thank you.